The American Institute of Cancer Research has listed some recommendations as a blueprint to beat cancer. And I think that I put this out there to first of all show that many of the lifestyle recommendations that we're talking about to prevent cancer or prevent a recurrence of cancer have been adopted by major groups and are the kind of things that we talk about within the field of integrative oncology. Now, I would say that there are differences for people depending on what type of cancer you're trying to prevent or what type of cancer that you've had. But there are influences that are generalized, and then for some cancers, these may be more important than for others, those that are more hormonally sensitive, for example. But in general, these are good guidelines, and I'm just going to read them off. Be at a healthy weight and maintain that weight. Be physically active. Usually that recommendation is 150 minutes of moderate physical activity per week, or really about 30 minutes, 5 days a week. It can be 75 minutes of more vigorous exercise, but I personally like the more consistent route of exercise. Limit consumption of sugar-sweetened drinks, limit consumption of red and processed meats. I think it's important where you get meat from also and how it's cooked. Eat a diet rich in whole grains, vegetables, fruits, and beans. Definitely the recommendations have been moving towards a more plant-based diet. Limit consumption of fast foods and other processed foods high in fat, starches, or sugars. Limit alcohol consumption. That has been more and more heavily emphasized, especially for certain cancers such as breast cancer. Do not use supplements for cancer prevention. We know that if you use supplements, or especially if you use natural products instead of conventional cancer treatment, that is associated with worse outcomes. And then if you've had a diagnosis of cancer, follow these recommendations.